Hello, this is Shawn Hamilton, Clinical Product Manager here at Access. Today, I will demonstrate the Therapy Evaluation tab within our new OASIS-C2 assessment. The Therapy Evaluation tab is available for physical therapy, speech therapy, and occupational therapy when an assessment is allowed for start of care per insurance requirements. The first section you will see in the Therapy Evaluation tab for physical therapy. Today I will actually show you the physical therapy tab. So for physical therapy, you will see this apply to all. The clinician will have the ability to click a drop down and select an answer that applies to whatever question that they're trying to answer. However, you also have the ability to assess the patient and to apply it to each section based upon what it is that is being assessed to allow you to document quicker. And if there is one thing that is different, then you're able to click on the drop down and add those answers as well. In the next section, we have the prior therapy received. And we know that prior therapy is received is very important, and we give you the ability to document if the patient has ever had home health therapy, if they have had an inpatient therapy visit, or received therapy in the rehab. That's very important, as you already know, and you're also able to identify more information regarding their prior therapy experience in the comment section here. The muscle strength testing is the same that we presently have, except we give you an ability to document this much quicker as well. And before I go there, I just want to show that there is this grading chart for a reference that you're able to look at here. Let's see. So if I decide that this patient's shoulder strength for all of the various sections of flexion and extension, etc., is a 5, and I want to apply it to all the sections, I can just hit apply, and then the information will automatically fill in for that section. Now, if by chance, let's say it's a 4 on the right elbow, I can just say right and apply it to the right side. Another thing I'm able to do is I can just type in WFL if that's what I need to type in, or if you use geometry, you're able to, type in information for that as well. So just want to make sure that you understand that. Even back to this section, let's say here is actually a 3. Let's see, a 3 plus, you're able to indicate that there. And if you need to change anything, you're able to change it. So you can get through your documentation much quicker that way. And so we have the upper strength and then the lower strength. And so you can fill out that table. The next section is the functional assessment. The functional assessment is the ability for you to document the patient's bed mobility, transfers, we go down further, as well as the balance, sitting, standing, the gait analysis, and if they have any assistive devices. So when we go back to the top of the functional assessment, if the patient, let's say they have bed mobility and there are no problems, you can just quickly document no problems with transferring. You can just document that way. However, again, let's say you do an assessment of the patient and we have these various things here for transfer, how they transfer, sit to stand, stand to sit, bed to chair. Again, you can do this apply all. This information here is the same that you are used to seeing in the current assessment, and you would hit apply to all, and all of that information will transfer here. And again, if there are certain sections of transferring that's kind of different than the others, then you're able to actually click on that information if it's different. We do give you the ability to utilize templates and then transfer comments. In this age of compliance with Medicare, it does no good to just simply write objective data. You also have to qualify it. So you want to write comments to express how transferring affects the patient's functional system and what you as a therapist will change in order to make their life easier. You can write that information there. And then we have the same thing here with the wheelchair, balance, sitting, standing. You can just, document that information here. The gait analysis, you can document that information. Identify here if the patient have assistive devices that they are using. Every type of assistive device that they're using, you're able to document that there. As we go further down the form, the next section we come to is the therapy toolbox. The therapy toolbox is a resource for you guys. It's not something that you have to use. You can choose additional tests as required by your agency or to provide more pertinent information in assist in formulating the plan of care. So for instance, the TUG test is something that is commonly used, so you're able to enter your information there. Some of the tests that we have here, we actually give you the actual test to fill out, and others we just give you the ability to enter the information. So for instance, the Tinetti test, you will see here that you have the ability to actually fill out the Tinetti test. And when you fill out the Tinetti test, it will generate the responses for you and give you your combined score. Another test we have is the Berg balance test. So you're able to fill that one out. The functional reach test is there for you. The mini mental exam is there for your use as well. So you can see here when we get to the 9-hole peg test, then you're able to enter the result. Same with the 2-minute walk, 6-minute walk. So we give you these different tests to enter. And what's important about entering the information here is when you get to your reevaluation, then those functional scores are also available and they pull over to the reevaluation. So you're able to document if the patient has improved based upon those scores. And then the last portion here is the identified needs. So this is just a tool to help you to look at some of the deficits the patient may have and to consider whether or not you need to order nursing for the patient or whether or not you need to have a referral for occupational therapy or the home health aide or speech therapy or MSW. And we have these identified needs for each therapist. And lastly, here is a checklist for the other disciplines that you are recommending for this patient's home health care. And even though throughout the OASIS assessment, you actually have the ability to enter these answers within the purple section, we just summarize who you have decided to add to the plan of care here on the therapy evaluation tab. So thank you for your time, and I hope that this demonstration was beneficial for completion of the therapy eval in the OASIS-C2 assessment.